Of course, we now know that when they say the hospitals, though, are being overwhelmed, it's almost always a lie. With the exception of a few big city hospitals in the U.S., our hospital system was stretched for sure, but it was never overwhelmed. And with the Delta variant, any hospitals that were stretched usually found themselves in that situation due to staffing shortages created by their stupid vaccine mandates. Fully vaxxed people can still test positive for COVID months later. They can still get sick, albeit not as sick, and they can still spread the virus. In other words, fully vaxxed hospital workers can still potentially spread COVID.
Laura Ingraham is back on her anti-vax soapbox despite the fact that there's over a 90% chance that she herself has been vaccinated. The Fox News host accused hospitals of lying when they report that they're overwhelmed due to COVID-19.
Those same workers are now being terminated from coast to coast for opting out of vaccine requirements. Across the country, we see healthcare staff being forced to choose between taking a vaccine they don't want or being fired from the jobs they love.
This comes as hundreds of health workers in New York were suspended after the state's COVID-19 vaccine mandate came into effect, which requires vaccination of all nurses, doctors, and other health professionals. They could officially lose their jobs overnight. And rather than help combat the conspiracy theories about the vaccine's ineffectiveness, which, let's be clear, Ingraham has given countless amounts of airtime to, she's insisting that hospitals and publicly available data from the Department of Health and Human Services is flat out wrong. I'm Caroline Johnson. Let's break down the numbers. So according to the New York Times and other sources, 1 in 4 ICUs in the US are full. And NPR reports that 58% of hospitals are under high or extreme stress. But let's get a little more specific. Hospital capacity experts tell NPR that when the number of patients for COVID-19 is over 10% of all hospital patients, that's when it becomes concerning. Right now, according to publicly available data on the HHS website, in the United States, 10.93% of hospital patients are there for COVID-19 treatment. And again, that's an average. So in many places across the country, it could be double or even triple that. ICU capacity is also another indicator of hospital strain. Experts say that when 30% or more beds are filled with COVID-19 patients, that means the hospital is experiencing high stress. Nationwide, we're at 25.75% of ICU beds filled by COVID patients. And again, many hospitals rise above that average. So it's clear hospitalizations are doing better than they have been in the past, but we are not even close to being out of the woods. For Ingraham to promote such a brazen, malicious lie is low, even for Fox News standards. She said most of the hospitals that are overwhelmed with patients have put themselves in that situation with, quote, stupid vaccine mandates. This totally flies in the face of statistics. New York Governor Kathy Hochul's office stated that because of the vaccine mandate, as of Monday evening, 92% of hospital staff, 92% of nursing home staff, and 89% of adult care facility staff had at least one vaccine dose. The vaccination rates increased considerably over the last 4 weeks as the state crept closer to the deadline. Let's not forget, Fox News has a very strict vaccine policy. It was reported this month that 90% of employees are vaccinated, and if not, they require daily testing. It's safe to say Ingraham and her chums are all inoculated against COVID-19 based on the fact that the Delta variant is a widely deadly strain of an already highly contagious disease. And I don't think Ingraham has taken many sick days. So while she's out here shaming scientists, immunologists, viral disease experts, and public health activists, why not go after Fox as well? We all know that would be a step too far, as her paycheck depends on it. Thanks so much for watching. As always, you can follow me on all platforms at Caro Johnson 917.